The Africans were the first to use drugs for managing hypertension and some psychotic disorders. One of their medicines, reserpine, actually traces back to their traditional medicine practices. They have a huge range of herbal remedies, and were just starting to explore and recognize the scientific understanding they had of plants. Plus, they were pioneers in farming. In recent years, there's been some debate over a significant discovery in Egypt and Nubia, where they found evidence of the earliest cultivated cereal wheat and barley, which dates back around 18,000 years, about 7,000 years ahead of any other civilization. Africans had access to aspirin long before modern medicine, utilizing Salix capensis, which contains salicylic acid, the key ingredient in aspirin. They were also using tetracycline 14 centuries ago in Nubia, as shown by its presence in Nubian bones, while Europe only started using that antibiotic in the mid-1940s. They were pioneers in various medical practices, including caesarean surgeries. When the caesarean was still considered experimental in Europe, doctors like Dr. Felkin traveled to Africa to observe Banyoro surgeons in Uganda performing the procedure, where mothers recovered well in just 4 to 5 days. In contrast, no woman survived a cesarean in Europe during the 1870s. They carefully noted the surgical techniques, stitching methods, and the instruments used. They noticed that the Africans were using the cautery iron with such amazing skill that there was hardly any tissue damage. In fact, such procedures would have led to major issues in European hospitals. They realized that the Africans were already using anesthetics and antiseptics in their operating rooms. Meanwhile, in Europe, they had only introduced antiseptics a couple of years before this operation. The observer pointed out that the Africans had been doing this for a while, showing routine skill in what was still considered experimental surgery back in Europe.